My name is Josh Berkowitz. I am an interventional cardiologist and I am a specialist in vascular medicine, director of the Vein Center at Tri-City Cardiology. So there's a spectrum of venous disease, and a lot of people have superficial spider veins, reticular veins, and they develop varicose veins. Most of those people, it is a cosmetic issue, and very rarely are they very symptomatic from spider veins, and that's not what we're treating. So when people have a lot of spider veins or varicose veins, the analogy I usually give, it's like the tip of the iceberg. We see varicose veins and spider veins. I'm not really worried about the tip of the iceberg. That's not what's going to sink the ship. It's what's underneath. It is how much venous reflux, it's how much impaired venous return, it's how much inflammatory venous disease that leg is having, and what's going to happen. It's going to progress to become more advanced, serious circulatory problems. So we always want to look underneath the varicose veins and see the status of the venous circulation. What is unique about the Tri-City Vein Center has interventional cardiologists that are all specialists in vascular medicine, specialists in venous medicine, and in cardiology. And what you get is this continuity of care, really looking at the cardiovascular system as a whole and not looking at it in different sections and different pieces. Edema and swelling and poor circulatory flow can be sometimes a primary cardiac problem. It could be a pump failure problem, and that always needs to be evaluated. But what happens a lot of the time is when there's poor circulation, it gets attributed to peripheral arterial disease, and that sometimes needs to be dealt with as well. But more often than both of those is a venous circulation. And the veins are really the part of the circulation that is responsible for returning blood to the heart and providing blood to be reoxygenated, get toxins filtered. And when the venous return is impaired and you have blood that is static and is pooling in the legs and is not able to adequately come up the legs unidirectionally to the heart, you get this kind of chronic inflammatory cascade that leads to serious medical problems and sometimes even amputation if it's not treated. A patient gets really a broad evaluation. I mean, we look at the cardiac system and how well the heart is doing, and we look at the vascular system, both arterial and venous. And a lot of times patients need medical therapy. They don't need surgery. They need to be on medicine switched or new medications introduced. Sometimes it's as simple as controlling high blood pressure a lot more aggressively than what's been done in the past. Evaluating that whole cardiovascular system and seeing where the primary problem is and being able to make changes in what is being already done for blood pressure, for cardiac disease, for vascular disease. I think that's what really makes our practice and our vein center really stand apart.